All right. Hi, everyone. My name is Sybil, and I'm the Communications Fellow here at Women Heart. A little bit about myself. I have a background in various areas of public health, and much of my work has been focused on using digital communication to promote health, which is exactly what I do here at Women Heart. I was really drawn to this organization, Women Heart, because of its focus on women living with heart disease. We are a patient centered organization that provides support, education, and advocacy to women living with and at risk of heart disease. I'm really excited to be here and discuss Heart Month, so let's get started. Today, I'll be talking to Celina Gorre, the CEO of Women Heart. Hi, Celina, how are you?
Doing so well. Nice to see you, Sybil.
Nice to see you. I am very familiar with you, but please tell us about yourself and what brought you to Women Heart.
Yeah, so I was working in London running a global health research funding organization, and that's where I learned that really the greatest threat to our health is heart disease. So when Women Heart came calling, I thought, what a great opportunity to make a difference in the lives of women. And so I agreed to move to Washington, D.C., and it's been a great move ever since. I'm getting to work with really fantastic folks like you and our champions. And also, I happen to love the outdoors, and surprisingly, Washington D.C. is a great place to do that, to go rock climbing, to go paddling, etc. So, yeah, I'm really pleased to be here.
Love that. So it is February and we are in Heart Month. It's also Black History Month, which means Women's Heart's annual 29 Days of Heart campaign is underway. Talk to us a little bit about the campaign and why it's important to Women Heart.
Yeah, so it started in 2016, and that happened to be a leap year, which is why our campaign is called 29 Days of Heart. And it's really a combination of honoring Black History Month at the same time as honoring Heart Month. And during this campaign, really the aim of it, the heart of the campaign, if you will, is to lift up the voices of Black women who have experienced heart disease, who've had a heart event or a heart diagnosis. As a patient-centered organization, we also wanted to honor very much the stories of patients, to make sure that we communicated about the experience of Black women with their own words, in their own words. So on social media, we're going to feature their stories. We're going to feature some really incredible quotes that I still think about a lot and every day that we do this work. And also, obviously, we're going to share images of our Women Heart champions, who are the volunteers that really fuel the work that we do here. And for the next 3 Fridays, we're going to be doing live interviews with some of our champions so that you can hear directly from them their heart stories, and then offer some advice and words of wisdom that they would like to share with other Black women when it comes to heart health. And really, in our organization, it's really about thrivership. So that's what I really want them to emphasize. I think, too, that, we can talk passionately about heart disease, but when you hear it directly from someone who's had firsthand experience, there's nothing else like it in terms of conveying the importance of focusing on heart health for women.
I love that so much. I love that we're not only sharing information, but highlighting and celebrating the stories of Black women. It's so important, especially during Black History Month. Can you talk about why Women Heart started this campaign?
Sure. So yeah, in addition to uplifting stories, which again is really the signature of how Women Heart communicates about heart disease, we also wanted to draw attention to the disproportionate impact of heart disease, which is experienced by Black women in this country. We know that nearly half of Black women have heart disease, and especially when you include hypertension or elevated blood pressure. Black women are also less likely than white women to be treated with preventive measures like aspirin or cholesterol lowering medication. And when you think about diabetes, which is a risk factor or comorbidity of heart disease, Black women again have higher rates of diabetes than white women. So I also wanted to mention here maternal health. We hear a lot about Black maternal health and the crisis of Black maternal health here in our country, and it is very real. And one thing that maybe folks don't know is that it is often linked to heart health. In other words, heart disease is the leading cause of maternal mortality. And so when we hear about women dying as a result of childbirth, it's often because their heart is the thing that ultimately caused their death. So I wanted to highlight those. It's really important to make sure that we have facts and good data and statistics, so that we have a context for these conversations to happen over the next several weeks. We also know that there is something, such a thing as structural racism and bias that further kind of make these disparities even more extreme. And we see that in heart health, in maternal health, and among Black women. You know, one of the aims here at Women Hurt is to fight for health equity. And in order for us to really achieve that, we do need to look at systemic change. We do need to recognize that there has been a history of racism in the US and in particular in the healthcare system. And so we want to think about how Women Heart can take steps to do something about it. And to talk about it is really the first step. And so here at Women Heart, we are really committed to this work, and we are engaging folks at the policy level, but also through education and awareness raising and advocacy, to stand up for women, in particular Black women, who are, who again are disproportionately affected. But we want to engage women as well in this fight, so that we are raising awareness alongside them.
This resonates with me so much because so much of my work has been around health disparities among Black women. So this is so good to hear. What can we look forward to during the 29 Days of Heart?
Well, Sybil, we're going to be all over social media, and I'm really excited for that. We'll be sharing health tips and recipes, which I'm a big foodie, so I can't wait to see these recipes. We'll be sharing quotes and facts around Black history. And, like I said before, we are going to be coming to you live at this time each Friday. So that's 1 p.m. Eastern, to have a conversation, right? To have a conversation not just with our champions, but also to engage some amazing partners that have agreed to support our campaign and to spread the word. So some of the groups that you might expect, like the American Heart Association and the National Forum for Heart Disease and Stroke Prevention, both really incredible organizations in their own right, and have graciously agreed to be partners on this campaign with us. But we also have some new partners, and I encourage you all to check out their websites. The one that comes to mind immediately is the Release the Pressure campaign. It's a campaign that is being led by the American Medical Association, and it focuses squarely on Black women and hypertension. And so the campaign is really to control blood pressure. And there is the In Our Own Voice campaign, which is a Black women's reproductive justice organization, and then also other really incredible partners like Diabetes Sisters, Mental Health America, and the Preeclampsia Foundation. And for those who don't know, preeclampsia is high blood pressure in pregnancy. And so, as you can see with these partners, we have a really big array of organizations that we work with, and these organizations see how heart disease is connected to diabetes and preeclampsia and mental health. And so that link between their work and heart health is something that they want to elevate, and we want to elevate alongside them. At the end of the day, Sybil, we are, whole people, and our health and well-being isn't just about the heart. But we also need to recognize that the heart is connected to everything. So controlling our blood pressure is important, just as alongside controlling our diabetes, as well as looking after our mental health and, generally speaking, our wellness. And for those who are, pregnant or wanting to get pregnant, obviously reproductive and maternal health is also really important. So I also want to just take a moment to thank our partners, really, because we couldn't do this work without them. And so we're just really grateful for their collaboration.
Oh, amazing. So we made it to the end of February and it's now March. What would you want your followers to take away from 29 Days of Heart in this campaign?
Yeah, that's a really good question. So I think first and foremost, I really want folks to absorb the information that we are going to be putting out throughout the entire month, and to recognize that health disparities, are real, and that if we collectively work towards fighting against these health disparities and improving outcomes for those who are most at risk, we lift up everyone. A friend of mine used to say, a rising tide lifts all boats. And that idea, that principle is, I think, something that we're really trying to emphasize during this month. But, I think also, quite importantly, I want folks to just be inspired. You asked me at the very beginning, Sybil, why I came to Women Heart. And there are few jobs out there where you get inspired every day. And the women that we get to work with, you've met some of them now, you've heard their stories. They are just incredible, and they inspire me and uplift me. And to have gone through the trials and tribulations that they've gone through, and to come out the other side wanting and needing to help others. I mean, that's just phenomenal. So I would encourage folks to hear these women, hear their stories, and also share their stories with others. They will be talking obviously from their personal experiences, but even though they'll be speaking directly about, their own individual experience, their stories will resonate with so many people, because their stories repeat themselves across this country in the lives of so many women. They are so passionate about helping others to take control of their heart health. They want women to seek support as they are going through their own heart journeys. And they're doing this work to spread awareness about the importance of exercise and movement, and how that relates to being heart healthy. That also includes healthy eating, which is, again, why we'll be sharing some recipes. And I think there's also this recognition that while there is so much out there that is not under our control, there's also a lot that we can control. And you'll hear from these amazing women just exactly how they took control of their heart health. So I just hope that folks will listen in, tune in, visit womenheart.org / 29 Days of Heart to learn more about the campaign, to follow us hopefully on social media, and to retweet and share the messages that we are going to be putting out. So I just want to really emphasize that I'm excited. I think we're all excited. Our team is all excited very much for this campaign. And before I close, I want to make sure to also thank you, Sybil, for all the amazing work that you've done for the organization. It has been so fun having you as part of the Women Heart team in general, and the comms team in particular. And you've just brought so much valuable and unique thinking to our approach to communications, in helping us to spread the word and to really increase and improve our reach, to make sure that more women are aware of their risk for heart disease.
Thank you so much. I really do love the point that you made about being inspired every day, because reading champion stories is my favorite part. Every day I'm like, wow, we are really doing the work, and we really have, some great people behind us. So yeah, thank you for that. And thank you all for joining us. Make sure you wear red today, and we'll see you next week at the next Friday. Thanks, Celina.
Thank you.
Bye.